Did you know that our teeth are the only part of our body that cannot heal itself? It's so easy for bacteria to get attached to our teeth and form cavities. Once that happens, the results can be very painful, and unless treated correctly, the cavity is only going to get bigger and more expensive to fix. So why is dental health so important? It's always good to have preventative measures for your teeth. After all, we do need them to eat. Imagine how hard it would be to enjoy even the simplest of meals. So naturally, our teeth, they allow us to be able to break down our food for an easy digestion. Many people don't know about the importance of dental health. Trust me, I was one of them. I've been working in the dental field for 4 years now, right out of high school, and being in that field has given me huge insight. I've learned about various diseases that can result when people don't keep up with their dental hygiene. By the end of this presentation, you would be able to recognize these diseases and how to get back on track with your dental hygiene. To sum up, today we will go over different diseases that can occur ranging from your gums to underneath the gum line, ways to prevent these diseases, and how you can seek professional help for any of your dental needs. To begin, let's talk about the types of dental diseases. The main disease that we are going to explore today is periodontal disease. Periodontal disease has two main features: gingivitis and periodontitis. Gingivitis is the inflammation of the gingival area, otherwise known as our gums, and this happens because of bacterial plaque that is attached to tooth surface, causing swelling and sometimes bleeding when flossing or brushing. Periodontitis is the most severe of periodontal disease. It's the formation of deep pockets, tissue destruction, and bone resorption around the teeth, ultimately resulting in bone loss. Both gingivitis and periodontitis develop from a lack of proper oral hygiene and the accumulation of dental plaque and calculus. In the International Journal of Health Sciences, Mohammed defines periodontal disease as a chronic inflammatory disease of the periodontia, which is the tissue that surrounds and supports the teeth. He goes on to say that its advanced form is characterized by ligament loss and destruction of bone. In average, periodontal disease affects 20 to 50% of the global population, and it is the main cause of tooth loss. With about 800 different species of bacteria found in our oral cavity, there is a severe increase in periodontal disease as you get older. The World Health Organization has kept data about our oral health. In these images, the scores range from 0 to 4. The higher the number, the worse the condition. Now that we've talked about the main types of dental diseases, let's move on to how to prevent these diseases from happening to you. First and foremost, floss. Flossing for me is the key to a healthy smile. Periodontal disease originates in the gum area, so flossing is a great preventative measure to get in those spaces between your teeth and underneath the gum line where bacteria and plaque find their perfect home. Many people think it's normal to bleed when you floss, but that's not true. In fact, it's an indication that you don't floss often, so when you do try to floss, you mess with all that inflammation that causes sensitive gums, and that's why you bleed. I have invested in a water pick, which shoots water through a very thin tube, allowing easy maneuver. That way you can get all those hard-to-reach spots like your molars. Chlorhexidine rinses are another way to prevent periodontal disease. According to the International Journal of Health Sciences, it helps reduce plaque by about 55% and gum inflammation by 30 to 45%. Recommended use by dental professionals is only for a short period of time, 2 to 4 weeks, since it can cause side effects if used excessively. The most basic way to prevent plaque buildup and cavities is by brushing your teeth. Today we have a variety of toothbrushes along with controversy on which is better for your teeth. Soft bristles or hard. Sally Crum, a periodontist and a spokesperson for the American Dental Association, says you're always looking for a brush with soft bristles. You don't want hard. And this is because hard bristle toothbrushes tend to be harmful for your gums and your enamel, causing tooth and gum sensitivity, gum recession, and tooth abrasion. There is, however, a specific way to brush to minimize harm to your teeth. So brush at least twice a day for 2 minutes in soft circular motions. You don't want to do up and down motions, as this causes gums to recede and will wear off the enamel that protects your teeth. The last useful prevention is fluoride. Fluoride has anti-plaque and anti-gingivitis effects that help reduce bacteria in subgingival areas. The hygienist that I work with says fluoride has minerals that bind to your teeth, preventing cavities and making your teeth stronger. Now that we know about the main types of dental diseases and how to prevent them from happening to you, let's talk about how you can seek professional help for your dental needs. You should be seeing your primary care dentist every 6 months. Regular checkups are great ways to stay informed about your dental health. Any concerns you have, be sure to ask your dentist. They are all after all the professionals, and we will have the best recommendations. There are many different factors to take into consideration when finding a dentist. Things like dental insurance, location, dentist credentials, and patient reviews are all things that you can investigate when looking for a dentist. If you have dental insurance, a good way to start is by calling them and ask these questions. Which of the dentists are in my network? What kind of dental work do they provide? And are they approved by the ADA? The next factor is location. This is as easy as checking your maps. You always want to find an office close to home so you don't spend too much on the commute. Once you have a better idea who's in your area, you can look into their credentials. This can include if they're in your network, if they have a current state license, and if they're board certified. I came across a specific tool that I believe can help you find the right dentist for you, the ADA Dentist Search Tool. I did mention selecting a dentist who is approved by the ADA, and that is because they are required to make certain promises like preserving patients' rights to stay involved in treatment decisions, staying current with innovation, and being as truthful and honest as they can with every patient. In conclusion, today we learned about the different types of oral diseases and how you can get back on track with oral hygiene. I walked you through some preventative measures and how you can find professional help for any of your dental needs. Everything mentioned is purely from my research and my personal knowledge of the terms. Ultimately, these are all things that you want to talk about with your dentist before taking action. Keep in mind that every patient is different, so you may not need some of these measures. It simply depends on your overall dental health and oral hygiene. What works for one patient may not work for the other. And although periodontal disease is one of the main causes of tooth loss, it is highly treatable and manageable, so don't be scared or intimidated. Get out there and find a dentist who you can trust, and with trust you will find your dental home.